Attention deficit hyperactivity disorder is the most common neurobehavioral disorder affecting children, and it may present in infancy and may continue into adulthood. It affects 5 to 8% of children and nearly 3 times as many boys and as girls. Nearly half the children presenting with ADHD may also have an associated learning problem. The term is commonly applied wrongly to the normal child who is always on the go and never sits still. Recognized causes of hyperactivity in children include normal variation, boredom or understimulation or excessive restraint, learning difficulties, autism, and partial seizures or drugs like clonazepam, phenobarbital, and phenytoin. So ADHD is also wrongly attributed to poor parenting, too much TV, poor schools, poor home environment, excess sugar or food allergies. No specific tests confirm a diagnosis of ADHD. A full physical or neurological examination must be done at all cases. The behavioral deficits and excesses that constitute a diagnosis of ADHD must be present in multiple settings, such as home and school. Cause is usually unknown. Related factors are hereditary and imbalance of neurotransmitters. So the symptoms are inattention. The child often fails to finish things, and when he or she starts, often does not seem to listen, has difficulty concentrating on schoolwork. Also, there could be impulsivity. So impulsivity, the child often acts before thinking, hits others when upset, inability to wait for his or her turn in a game, engages in dangerous activities without consideration of consequences, and has difficulty organizing work. This is not due to cognitive impairment. For hyperactivity, child tries to do several things at once, talks incessantly, struggles to sit still at a desk, and fidgets. And distractibility is evidenced by not listening when spoken to, an inclination to daydream, not being able to work independently, and also disorganized. The signs that are usually elicited are similar to the symptoms. Investigations are usually none. Treatment objectives are to reduce hyperactivity, to improve attention, to improve compliance to instruction. Non-pharmacological treatments, behavior management techniques, for example, class helper to sit with a child and to focus attention to schoolwork, parenting class to help parents cope, desist from punitive physical interventions like caning. Pharmacological treatment, you give methylphenidate oral in adults 10 milligrams 8 to 12 hourly, the maximum doses of 60 milligrams, and then increased weekly by 5 to 10 milligrams if necessary to a maximum dosage of 30 milligrams 12 hourly. Children 6 to 18 years, 2.5 to 5 milligrams 12 hourly, and increased weekly by 5 to 10 milligrams if necessary to a maximum dosage of 30 milligrams 12 hourly. 4 to 6 years, give 2.5 milligrams 12 hourly, increase weekly by 2.5 milligrams daily to a maximum dosage of 1.4 milligrams per kilogram if necessary in 2 to 3 divided doses, and less than 4 years is not recommended. Or you can give atomozitine oral in adults 40 milligrams once daily for 7 days, and then you increase according to response to a maximum dosage of 100 milligrams. In children more than 6 years with weight greater than 70 kilograms, give 40 milligrams once daily for 7 days, and then increase according to response to a maximum dosage of 80 milligrams. And more than 6 years with weight less than 70 kilograms, give 500 micrograms per kilogram daily for 7 days, and then you increase according to response to a maximum of 1.2 milligrams per kilogram daily. Less than 6 years is not recommended. Second line treatment, you give imipramine oral in adults 75 milligrams daily, and then increase to 150 milligrams daily if necessary. The maximum dosage of 200 milligrams per day. In children 6 to 18 years, we give 10 to 30 milligrams 12 hourly. Referral criteria. So refer to a clinical psychologist for behavior management, an occupational therapist, remedial teacher, speech therapist, following a needs assessment, and refer to a specialist if there is no clinical improvement after a month of the recommended therapy.